the Epilepsy Foundation Alabama podcast. My name is Sarah Franklin. Before we get started into today's podcast, I do want to thank Greenwich Biosciences for sponsoring this podcast of the episode. And with me today is Sally Schaeffer. She also works with the Epilepsy Foundation and is the director of the SUDEP Institute. Thank you, Sally, for joining us today.
Thank you so much for having me.
I know when I started with the Epilepsy Foundation in 2019, I had not heard of SUDEP before. I didn't know much about the acronym and learned about it shortly after starting. So for those of the people that might be listening today or watching their video recording, can you give an overview of just what is SUDEP?
Absolutely. SUDEP is an acronym for Sudden Unexpected Death in Epilepsy. And it's a death that occurs with someone that's otherwise healthy. So when they do an autopsy, they don't find anything else that had occurred with it for the person health-wise, and therefore it was death from epilepsy. Sometimes, and most often, SUDEP occurs in someone's sleep, but it doesn't always have to. And so that is what the acronym SUDEP stands for.
Thank you, Sally. And just tell me, I've heard you speak one time before. Just tell me a little bit about your family story. It's so inspiring and, of course, led you to this role.
Absolutely. Thanks for letting me share this. So I am blessed with 3 beautiful children, and my middle child, Lydia, was born with a rare chromosome disorder, very rare. In fact, she was only 50 in the world with it. Along comes with chromosome disorders, sometimes other health concerns and issues. And she had many, and one of them was epilepsy. At a year and a half, she had her first seizure, and she didn't have them often. So we felt we weren't concerned at the time. But at around the age of 3, she started to have more seizures, and we eventually went and got an EEG, and she was put on daily medication. And it seemed to control it, except for when she would become ill or there'd be other issues that would arise for her. And around the age of 6, she had a very severe tonic-clonic, and it just presented itself differently than it had ever before. And we delivered emergency medication, and it didn't stop it right away. And I knew that we needed to see the neurologist right away, in which we did. They did another EEG. At first, they wanted to just do a 3 or 4 EEG, but 3 or 4 hour EEG. And I really encouraged a long term. I said, why don't we do overnight? Don't know why I said that, but I'm thankful we did, because when they did the overnight EEG, they found a very rare nocturnal epilepsy called electrical status epilepticus in sleep, or otherwise known as ESES. What this meant for her is that she seized over 80% of her non-REM sleep. And you couldn't see these seizures with the naked eye when we would lay her down to sleep, and it looked like she was sleeping soundly like a baby, and in fact her brain was actually seizing. So we tried a number of medications. Having a rare chromosome child, it is harder to attack these types of epilepsies. Just the odds were against her a little bit. And so we tried a number of options. I actually also fought for a therapeutic treatment, legalizing another therapeutic treatment for her. A law was passed in her name on April 16th, 2014. It's called Lydia's Law. I was fortunate enough to work with a number of wonderful parents from around my state to make this happen. And I also fought federally as well. But unfortunately, we didn't have this therapeutic treatment in time to even try for my daughter. And on Mother's Day, May 11th, 2014, she never woke up. And so what inspired me to be here, I guess, which is your next question, is that my daughter was given to me for a reason, but she was also taken to me for a reason. And I found my voice the day that she was born. I had a lot of instincts about her to help her. I fought for her educationally. I fought for her in the medical space. And so it was no different when I was working to gain another legal option for her to try. And then after she passed, I fought federally for this option. And I knew there was something more for me to do with this journey. I just didn't know what that was. And in 2018, I was hired on to be the senior director of the SUDEP Institute. And certainly using my voice, using my passion, and not only speaking for my daughter now, but for all the individuals who have lost someone they love to epilepsy, whether it be to SUDEP or whether it be to some other accident or drowning, to really bring a voice to everyone, to help create more awareness and more education. So we can talk a little bit more about that, but that's really how I found my way here. And it's been a labor of love. It's not always easy, but certainly it's where she not only wants me to be, but it's where she needs me to be.
Yeah, and it's just really neat how you've been given. I mean, that gives you inspiration to wake up and do your job every single day. And I know, we've talked a little bit about there is SUDEP, and then there are accidents that can happen while someone's having a seizure that can also, unfortunately, be the reason that someone loses their life. So can you talk a little bit about the differentiation between the two, and how the SUDEP Institute supports people through loss in general?
Sure. So SUDEP, a sudden unexpected death in epilepsy, they really don't know what causes it yet, whether it's cardiac, respiratory, or is it from the brain, or is it a quiet storm of all of them? And so there is research that is going on across the world, many folks that are embedded in trying to solve this and end this. And really, it's funny, when I got hired, that's what they said to me. We want you out of a job because you've helped solve SUDEP. And so that is the goal, is that I am out of a job, and I couldn't ask for anything more because that means no one else is dying. But because people suddenly and unexpectedly die from this through what they call SUDEP, it's different from maybe a drowning. So if somebody has a seizure while they're swimming or in the bathtub, that's different than SUDEP because you're having that seizure and then drowning from it. Or say if someone has a seizure and they're driving and they get in a car accident, that is different than SUDEP, where it's just very unexpected. It's very sudden. And granted, those deaths are sudden too, but it is different. But the Epilepsy Foundation SUDEP Institute supports all those passings, and we try to educate as much as we can, first of all, to the physicians and the families and people who are living with epilepsy, to feel empowered about their epilepsy, to ask the questions of their physician. Am I at risk? What is my risk of SUDEP? What is, should I be driving? Should I be bathing? These are all bathing alone. These are all questions that we want to help create knowledge around. We want people to feel empowered by having more information and not fearful. We could very much say nothing about death from epilepsy or SUDEP, because I know it's a very scary and uncomfortable topic. If anyone, I get that. I have a daughter who's gone. But my goal and the foundation's goal is to really empower people with information so that you feel stronger, so that you know what to ask and you know this information and you can go and talk to your doctors straight on about it. Because to be honest, not every physician is talking to their patients about SUDEP or really stressing the fact that you shouldn't be bathing alone. I talked to a mom I think in December, and she lost her daughter to epilepsy because she was bathing alone. And she said to me, the doctor mentioned it, but didn't really stress it. I wish he would have stressed it to my teenage daughter even more, that she shouldn't be alone in a house taking a bath. And so the SUDEP Institute, we have a flyer on epilepsy.com/SUDEP that it says SUDEP, knowledge is power. And that's really our goal, is to give you tips and information so that you can go have these direct discussions with your physician to know your risk for SUDEP and maybe accidents or swimming and things like that. So that is really the goal of the SUDEP Institute, is that we empower people with information so that they feel stronger. And I feel we've done that in so many ways, and it's a job that we just need to keep doing and educating. We also, on the other end, not only empowering people living with epilepsy and their caregivers, but we're also stressing the importance to physicians and the medical professionals, all of them, whether it be a general practitioner, whether it be a neurologist or an epileptologist, or whoever someone is seeing, a nurse practitioner, that they need to talk about SUDEP and death from epilepsy. again, as uncomfortable as it is really necessary to give people the information they want and need. And that's why for us, we're the Epilepsy Foundation. It's our responsibility to do this too. So.
Right. And in the unfortunate circumstance that that someone is lost to SUDEP, what resources do SUDEP Institute and the Epilepsy Foundation offer the family?
Support system we have is an bereavement support specialist. And this is someone who isn't a counselor, but she is a bereavement specialist that has had bereavement coaching. And she also lost her daughter to epilepsy. And she helps people by talking to them via phone, live, or text, or email. Sometimes it's easier just to put your thoughts out on and just type them and share them with someone. And she does that as well. I also have talked to people all the time about their loss and how we can make a difference. So we offer that support system, and we hope that people know that they can lean on us.
Definitely. And then can you tell me a little bit about research being done as it relates to SUDEP?
So the government, the NIH, actually just got done funding, I want to say it was 5 years, $27 million of research with the Centers Without Walls. And that research was specifically around SUDEP. And there's other researchers as well that aren't with the NIH grant that just got done funded. But I know, as far as besides people across the world doing research about SUDEP, the SUDEP Institute is also encouraging research. We have a biomarker challenge until October 2020 here this year that we will award $800,000 to someone who provides us with a valid predictive biomarker to help prevent SUDEP. It may not tell us what the cause of it is, but if we can find a biomarker that would help prevent SUDEP, that would be a huge win for the epilepsy community and provide a safe feeling. So that is something we're doing with the SUDEP Institute. The other thing that we're going to be hosting is a summit where we're bringing minds across the world together in and out of the SUDEP space to really talk about a couple of different areas such as epidemiology, basic science, awareness and education, to really create a uniform message and figure out what our 5-year action plan is for SUDEP. So that's something that we're initiating as well. And that's bringing together the people that were in the Centers Without Walls, as well as everyone that we can that's doing some research in the SUDEP space together, and really creating some uniformity around what's being done and putting that action plan together with this coalition. It's really amazing, really, really amazing. And everyone is very, very excited to be working together, which I think is great because we do need to end SUDEP.
Absolutely. And I know one thing that you've really worked hard on over the past few months is working with the Boyce family. Cameron Boyce, a Disney actor, was lost to SUDEP. And so talk a little bit about the No SUDEP Now campaign.
Absolutely. Cameron Boyce died in July of 2019 at a very young age. He was in his 20s. And so it hit close to home when I saw that he passed, and he was larger than life. You could see on TV. My kids grew up watching him and really enjoyed his show Jessie and the Descendants. And so as someone who has lost a child, I reached out to Libby to just let her know that we are here for support. And we ended up partnering with the Cameron Boyce Foundation, Libby and Victor and the Cameron Boyce Foundation, on an initiative called No SUDEP Now. And it really is this initiative with our two organizations brought together to bring awareness and education, and also fundraise for research dollars to end it. They too just want it ended, just like many of us who have lost someone we love to SUDEP and epilepsy. We just want to end these unfortunate passings. And so No SUDEP Now brings their voice and the Epilepsy Foundation together to bring that awareness. In 2019, we were on Good Morning America together to share more about the loss of Cameron, as well as a little bit about my loss of my daughter. And then we were also on the show The Doctors, so you could YouTube that if you wanted. The Doctors aired in January of 2020. talking a little bit again more about Cameron's law, or the loss of Cameron, talking to Victor and Libby about that loss, but then also talking with me about SUDEP and what questions to ask the doctor and how to reduce that risk. So it's a unfortunate partnership because I don't want anyone to be lost to epilepsy, but I'm so happy that Victor and Libby have helped join and use their voice to make a difference to end SUDEP.
Yeah, I think, it's like we talk about a lot, we're stronger together a lot of times when we band arms with those just looking for ways to reduce seizure activity, end SUDEP, all those kinds of things. So
absolutely. And Sarah, that brings up a really good point. We are better together. And that's why with the SUDEP Summit, to bring together a coalition of voices, no matter what organization, we have several organizations on that. But then also I like to meet with several organizations on a quarterly basis. It's been kind of hard with COVID-19 right now, but meeting with other organizations to really talk about, what are they doing? How can we help? How can we support? How can we be partners in it? Because again, we're going to be better together. And honestly, I don't really care who ends SUDEP. We just need to end it. And depending on what organization or what researcher or what person brings that forward, that is going to be an amazing, amazing day. And so if we can partner together, work together, band together, that's only going to do this community really, really good. I mean, that's
the goal, right?
Yes, that is the goal.
Great. And if people want more information about the SUDEP Institute, can you just remind them the web address and how to get in contact with the SUDEP Institute?
Absolutely. They can reach out to us in multiple ways. They can call our information and referral services phone number, 1-800-332-1000. We have skilled and wonderful people answering the phone, and you can let them know what you need. If you want more information on SUDEP, if you would like bereavement support, whatever you need, that's a wonderful number to call to get that information. The other way that you can go is to epilepsy.com/SUDEP. It will take you to the pages on our website about the SUDEP Institute and about SUDEP. There's some videos there and other information, and we're working to update that as well. And then the last way they can reach out is by emailing, and they can email at sudep@efa.org. Again, that's sudep@E, F as in Frank, A as in Apple.org.
Great. Well, I really appreciate your willingness to share your story, to lead the SUDEP Institute, and just to take time with me today to kind of talk through a lot of this. And I look forward to sharing it with those that follow the Epilepsy Foundation. Thank you, Sally.
Absolutely. And thank you so much for all that you do for the Epilepsy Foundation. Thank you for asking me to be here today. I know this isn't always an easy topic for everyone, but I'm so thankful that the organization supports the mission of eradicating SUDEP and supporting those affected by it. So thank you again.
Thanks, Sally. Again, we want to thank Greenwich Biosciences for sponsoring this podcast. If you're interested in also supporting the Epilepsy Foundation, visit www.give26.com and consider giving $26 for the 1 in 26 people that will develop epilepsy in their lives.
Everyone, my name is Amy Padgett, and I'm honored to be speaking to you virtually today on behalf of Greenwich Biosciences and our entire team. As a sponsor of these podcasts, Greenwich Biosciences is proud to partner with the Epilepsy Foundation for events like this to help people stay connected in this virtual environment. We are united in what we are trying to accomplish here today, to raise epilepsy awareness, to have a positive effect on care, on research, and on the lives of those who are impacted by seizures. There are so many families who wake up every day to the reality of epilepsy. There are people listening to this right now who have been fighting against it their entire lives. And there are others who are not able to join us today. But as a community, we will never give up the hope that in one day we will overcome the challenges of living with this disease. This is what drives us. You may know us best as the company researching and delivering FDA-approved cannabinoid medicines to help address serious conditions, but also know that our focus is you. Patients and families are at the center of everything we do, and we strive to make a positive and meaningful difference in their lives in your lives. Today and every day, we are proud to be here with you, virtually and in real life, to raise awareness, take action, and continue the fight to end epilepsy. And thank you for allowing us to be a part of this event.